There is thyroid receptor sites for thyroid hormone on every single cell in your body from head to toe. Your thyroid is impacted or impacts everything. And so if we're just looking at these very basic thyroid markers and we're not taking into consideration our blood sugar and detoxification and adrenal function and brain health and our hormones and our gut health, like we miss everything. And that's why so many women are still suffering from symptoms, even though they may be on thyroid medication and their labs may look good. It's because they're only looking at a few labs instead of, oh, if you still have a symptom, it must be somewhere. So what else could it be?
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who is out there helping us humans to explore, expand, and explode. Hey, welcome to The Exploding Human. My name is Bob Nickman. My guest today is Dr. Heather Stone, and we're going to be talking about thyroid and autoimmune issues, particularly in middle-aged women, and her own personal story of how she became a practitioner specializing in this field. But first, I'd like to invite you to visit my website, theexplodinghuman.com. Over there, you can listen to episodes, read synopses, see photos of my guests. There's a little bio on myself. There's also a YouTube channel where you can listen that is The Exploding Human with Bob Nickman. As I said, my guest today is Dr. Heather Stone. Heather's personal story involves being diagnosed with low thyroid and Hashimoto's, and she was not getting the satisfactory results from her doctor. So she began to study this particular field, and after getting out of medical school, this became her passion. Most of her own personal patients are women with these types of conditions. However, the information we're about to talk about really speaks to the medical profession, testing, autoimmune issues, our food systems, agriculture. It's a very holistic and functional approach to achieving optimal health, especially happens to be in the field of thyroid, but we can extrapolate much of this information for all of us. So I'm going to let her tell you her story, and we're going to get into this right now. This is Dr. Heather Stone. Good morning, Heather Stone. First of all, let me say that sounds like a famous person to me, like a famous person's name, like an athlete or an actress or.
Well, I'm a doctor.
I know,
but so I'm not famous yet. But maybe one day.
Well, I hope so. I hope your work gets out there, and that's why we're here to talk about that. And I know you're in Texas, and you're a Texas gal, and so we're and I like to say gal because that's very Texan, I think, isn't it?
That's fine.
Yeah. I like stereotypes up to a point until they don't work, but I'm glad you're here. We're going to talk about the thyroid, and let's start with what brought you to become a doctor because of your own issues with thyroid. And the other thing I did not know is that. The issues you had are most prevalent in middle-aged women, which I did not know that. So let's go from there because your story is great because I love the fact that somebody has an issue. The problem's not getting solved by professionals. And so they go out and they figure out what is going on. And you actually became a doctor because of it, which is totally amazing.
Yeah, well, I wanted to be a doctor, but I did not know which kind of doctor that I wanted to be. So I was in pre-med and I was going to be a dentist. And then interestingly enough, before I went and took the entrance exams for dental school, I went and followed a dentist. I'm like, oh my God, I do not want to do that. That is the worst thing I could ever imagine. I'm not going to be a dentist. I'm like, what in the world am I going to do? And I knew I didn't want to be a traditional medical doctor. Like that just didn't really fit with me and in the way that I was raised either. So I was struggling with weight. I was about 50 pounds overweight and I was tired. And then you kind of brush a lot of things off. I mean, you were in school and working, and of course you're going to be tired. But I was working out a lot, tired, really overweight. And, as I said, I was in pre-med. So I'm like, well, and this was pre-Google. So you couldn't just easily look it up. Like, maybe I have a thyroid issue. I mean, all my symptoms are pretty consistent with someone who has low thyroid. So I go to the best, OB-GYN, because I had issues with my menstrual cycle as well. So I go to the best OB-GYN in Austin at the time. And I said, hey, could you maybe check my thyroid? I have all of these symptoms. I'm not sure what all's going on. And so he's like, sure, I'll check your thyroid. So he ran my labs. I came back in a week and he's like, well, nothing's wrong with your thyroid. Everything is fine. And I think that you don't have a menstrual cycle because you exercise too much. And what he was referring to is when women work out a lot and they have really low body fat, like 10% body fat, then you start losing your hormone cycles and you won't have a menstrual cycle. But I was 50 pounds overweight. And so when he said that, I was like, that doesn't make any sense to me at all. And I am thankful for that whole experience, even though at the time it was pretty frustrating and almost detrimental. So he helped me zero. And when I was walking out of his office, he said, oh, by the way, you're probably not going to be able to have kids either. You're going to need fertility treatments and all of this stuff. And I was like, that's really interesting. And I was sad. I was a little angry. I was frustrated because I felt like when you go to the doctor, those are the people that are supposed to be helping. Those are the people that are supposed to be digging and trying to figure out why you have a health issue. But instead it was, well, we ruled out the thyroid. I'm not going to dig any deeper and figure out why you're having these issues, but I will be here for when you can't get pregnant, right? Like we'll put you on all these fertility drugs. And I'm like, this cannot be it. I am not going to sit here and live my life with these symptoms. I know that there has to be something different. And I said, this is what I'm going to do. I'm going to figure it out. And so once I was on the path and I figured it out, I mean, it took me at least 2 years to figure it out. It took me a year to lose the weight. And I'm like, there are millions of women who are suffering with these symptoms, and they are being told that, just live with it or take this pill and, the symptoms are miraculously going to go away, but they don't. They're told, oh, you can't have kids. Let's just do all these fertility treatments. And it's just this roller coaster that many, many millions of women are going on through their whole life. And it starts in the middle age, right? Like around the time that we're having babies. And it's so frustrating. And so I just figured that I would help all of these women out so that they did not have to live like that, because I was not going to live like that either.
I find it really interesting that the thing that he sort of threw in at the end there was come to me for fertility treatments, and gee, whoa, your field happens to be the one I need the most. Ka-ching. Come on, pal.
Yeah.
And
exactly.
let's talk about something else here, testing, because there's ranges in testing that are based on certain factors of a quote healthy normal population of a certain age group and all these things, but they don't necessarily reflect what's going on with people, from what I'm discovering. That they're valuable up to a point, but what isn't, who's to decide what normal is, and how is that decided? And so when I get, my tests back, I'm always I'm looking at the range, but I'm also questioning the range, and I'm questioning the testing. I do all that in my head, because here's the thing: people know when something isn't right.
Yeah.
They know when something isn't right with their body. They go, I don't feel right. Something's off. And when we can trust that instinct, and that it's not even instinct, it's knowledge. It might be not knowledge based on scientific testing, but we know when we don't feel right. And for when a doctor says there's nothing wrong, and you know that there is, that's the point, and that's obviously where you were, where you went, no, that's not correct. I know more about me than you know about me.
Yeah, and I think so many of us fall into that place. So that's kind of like a double question, and I'll take the first one, and then we'll talk about the testing ranges and all of that. So
Okay.
first of all, your body was born to heal, right? Like we know that from the beginning because we are a self-healing mechanism. We don't have to think about our heart beating or, if we cut ourselves, creating a scab. Like our body is always moving to heal and moving towards survival. And so when you have a symptom, that's your body's first, it has the ability to communicate with you and let you know that something is not quite right. And for the most part, we don't go from perfectly healthy to disease. Especially when we're dealing with an autoimmune or degenerative disease process. Now, certainly some genetics can turn on or something, crazy can happen. But for the most part, especially us here in America, we're dealing with chronic degenerative diseases, and we do not go from perfect health to diagnosable disease. It doesn't happen overnight. It happens over a long period of time. And when you start to have the first dysfunction, that's when you start to get symptoms. Maybe you don't feel quite right. Maybe you're not sleeping well through the night. Maybe you have low energy. Maybe your hair starts falling out. Maybe you have a little anxiety or depression, or maybe you start to get a little brain fog. And then for a lot of us, we just keep pushing through, men and women. We just kind of push through those initial symptoms. And, maybe that's like a weird thing and your body just can heal and move on. But the symptoms, if they start to persist, they usually will start to get worse over time. But it's just your body like talking a little louder at you saying, hey, I got an underlying imbalance here that needs to be addressed, and I need your help with that. And a lot of times in our culture, and in Western medicine, we start taking medication to cover up the symptom and override the body's physiology, right? Like if you get headaches, you start to take Advil or Excedrin or whatever it is that you take, some kind of pain reliever to make the headache go away. But what if that was a message that your body was saying, hey, your hormones are a little out of balance, or hey, you've got a sensitivity to gluten or dairy or soy, and you're getting inflammation and your body's giving you a signal that there's something wrong. But we continue to cover it up over time until it becomes a big problem. All right. So your body communicates with you. It is a self-healing mechanism, and your symptoms are just a communication that your body is out of balance. Now, and we all know that, and we have to get back into touch with that, because a lot of times in our society, the power is given to the doctors instead of maintained at the patient level, because the patients, we know more about our body than anybody else. Like you said, we know when something's off, and we have to really advocate for ourselves, and it's okay. Now, when you go to the doctor and you have these symptoms, they run basic tests, and you have to realize that their job, and I'm talking about traditional doctors, their job is to find and diagnose a disease and give a medication. That is how they're trained.
Yeah.
Right. It's the, pharmaceutical, the symptom diagnosis pharmaceutical model. Like that's just how they're trained. And there is a time and place for that for sure. But a lot of times we don't fall, or we don't have a disease yet. So they're looking at these labs, and when you fall outside of the lab ranges, that's when they say, oh, you've got type 2 diabetes. Here is your medication that you need for type 2 diabetes. Or they run a TSH, and they will say everything is normal up until the point where your TSH goes over the lab range. It might be right at the edge of the lab range, and they'll tell you everything is fine. And only once it goes over the lab range, they diagnose you with low thyroid and give you thyroid medication. But what we must understand is that these labs, these ranges are averages. So they take a region, and they take, like, since we're talking about thyroid, we're going to use TSH, because that's typically what doctors run to diagnose low thyroid. So they take an average of a region, and they graph it on a bell-shaped curve. And they take the middle, they take the median, and then they go 2 standard deviations away. front and behind and above, right? So that's the lab range. And so the lab ranges aren't based on research necessarily. They're not based on optimal function. They're based on averages. And it's really amazing. And most people do not know this. Like if you said that you were in California or Los Angeles, the lab ranges there are going to be completely different than the lab ranges in Texas. So somebody could be diagnosed with hypothyroid in California, but not in Texas. It's pretty amazing because I see patients in Colorado, Arizona, and Texas, and there's different lab ranges for each state. And it's like, this is just fascinating because we think, like common sense would say, that these ranges are scientifically, you get them from scientific data, and we don't realize that these ranges are just averages, right? And that we use to diagnose disease. But there are optimal functioning ranges, which are much smaller than these giant ranges that we get from the lab. And so if you're experiencing symptoms and you don't have a diagnosed disease that requires a medication, I would say 10 times out of 10, there's some imbalance that you have where you're falling out of the optimal ranges, where we could find where the issue was before it becomes a disease.
That was one of the best explanations of testing that I've heard. And I've only heard two, but still.
And I could keep going too, because what's really crazy is like when I went into that doctor's office and I said, could you check my thyroid? He probably would have just checked a TSH. I don't know, because I didn't get the labs, because I didn't know to ask for the labs. Plus there was no Dr. Google, so I wouldn't have been able to do anything with the labs. But the interesting thing is that most doctors are running the labs to diagnose and give a medication because that's what the insurance pays for. Like if doctors ran all of these labs, but it wasn't going to change their treatment with medication, and they get in trouble from the insurance companies, and they will run minimal labs, the least amount of labs as possible. But when we're looking at overall human physiology, we cannot continue to separate out systems. Like, for example, the thyroid, there is thyroid receptor sites for thyroid hormone on every single cell in your body from head to toe. Your thyroid is impacted or impacts everything. And so if we're just looking at these very basic thyroid markers and we're not taking into consideration our blood sugar and detoxification and adrenal function and brain health and our hormones and our gut health, like we miss everything. And that's why so many women are still suffering from symptoms, even though they may be on thyroid medication and their labs may look good. It's because they're only looking at a few labs instead of, oh, if you still have a symptom, it must be somewhere. So what else could it be?
Yeah. Well, that's actually a great question to ask yourself when you're trying to diagnose somebody. Well, it seems to be this, but what else could it be is a great question to ask, because it's not always the thing you think it is, or it could be something in addition to the thing you think it is. So,
that's right.
These things don't exist in a vacuum, which is sort of another part of the model of, it's like, oh, it's like looking at a human being like you would a car. You have a leaky transmission, so we're going to put a new seal in the transmission where it meets the engine. That's where it's leaking. Well, you might be putting crappy oil in there. You might be driving over bumps every day and cracking the that part of the transmission. You don't really know that. I mean, hopefully that. But if you look at the human body that way, I think it's a little bit limiting. It's almost like, well, you have a cut, we're going to put a Band-Aid on it. That doesn't really work in terms of the internal machinations of the body.
Right. And if we take a medication to cover up a symptom and we don't get down to the root cause of why we have the symptom, the body is like, it's trying to help you. So you have one symptom, let's just say you're tired, and then you drink coffee and so that you're not tired anymore, or you can't sleep, so you're taking sleeping pills. Well, it's like, okay, well, maybe she'll listen if we give her depression, or maybe she'll listen if we start having anxiety. Maybe she'll listen if it just starts moving forward. And then when you're taking medication to cover up a symptom, you're always dealing with side effects of those medications, and it just really goes nowhere fast.
So you started to discover that something was going on with your thyroid. You were diagnosed with hypothyroidism. Is that what it's called?
So
which is underactive?
Yes, that's right. So anything that says hypo is underactive, hyper is overactive. So I actually found out that I had Hashimoto's before anybody diagnosed me with hypothyroid. So Hashimoto's is the number one cause of hypothyroid, all right, or underactive thyroid. The research is showing 90 to up of 98% of women who have low thyroid actually have Hashimoto's, which is an underlying autoimmune condition where the immune system is attacking the thyroid. So we always have to ask why, right? So like if you do have low thyroid, we got to say, well, why do you have low thyroid? The thyroid doesn't usually just quit. Like the body doesn't usually just quit working. Like there has to be some underlying mechanism that's creating this issue. And for most of us diagnosed with hypothyroid, it's because we have an underlying autoimmune issue where the immune system is attacking and killing the thyroid.
It's an autoimmune disease. I don't really like the word disease for that. It's a condition to me because if it can be corrected or how
we
is
say that it can go into remission, right? It can go into remission.
Mm-hmm. So what was in your case, what did you do to help you with that? Because you're obviously, as I'm looking at you, you're very vibrant and healthy. It's very obvious.
Yes. So, well, the first thing I did was, and we didn't really know a lot about Hashimoto's back, I think this was 23 years ago. But the first thing that I did was I started changing my diet and I started getting my blood sugar under control. Now, remember, I didn't have hypothyroid, so I didn't require thyroid hormones or thyroid medication. I just had all of these symptoms and an autoimmune condition. And so when I started changing my diet, it wasn't a fad diet. It was a diet of how do we regulate your blood sugar? How do we get out foods that are causing a lot of inflammation or triggering autoimmunity? And I would say the biggest food, if anybody listening has an autoimmune condition or a thyroid condition, the biggest food to remove is gluten, because gluten is so highly inflammatory and it actually triggers the immune system to attack the thyroid. And the research is moving towards it also makes the immune system attack the brain. It's more of a neuroendocrine issue when we're eating gluten. So gluten is a huge one, and it will make the biggest difference in somebody's life if they would take that out who has autoimmune issues.
And it's such a prevalent item in all the breads and all that kind of stuff. And my understanding is that in other countries, and particularly Europe, it's different. The gluten is different there.
It is. And when I go over to Europe or Italy, I won't feel bad if I eat a little bit of pasta or if I ate some bread. Like it does not affect me at all the same way that it affects us here in America. And it's interesting because I've had patients go over there, patients with diabetes, and they go over there and they're checking their blood sugar. And one lady in particular, she went to Germany and she goes, Dr. Heather, I had a chocolate croissant every day. I was just going to go crazy, but that was the only thing I was going to eat bad all day. And she said, I was checking my blood sugar before I ate it and after I ate it and that night. And she said it did not really move much. And if she even looks at any kind of bread here, her blood sugar will spike. I mean, like really spike. And it's amazing the foods that we have here in America, how much different they are over in the European countries, just because they don't allow all of the pesticides. They don't allow a lot of the herbicides. They don't allow GMOs and hybridization as much as we do over here. And so our food system has changed dramatically. And I think if you will look at it, in the 90s is when we really started dumping glyphosate all on the wheat. And that's when we started to see a big shift in autoimmune conditions. And that's when people started having an issue with gluten. Because I think, if I look back on my childhood, nobody had food sensitivities. Like it was
Rare.
really a thing.
Yeah, there was always that one kid that had a peanut allergy, and that was about it.
It was the random peanut allergy that you may had, and there was ADD, and ADHD was very low occurrence. There was very little chronic degenerative diseases in the childhood population or even in the adolescent population. And I think it's just, it's just growing exponentially right now because of our food system.
Interestingly, I was talking to my daughter who's in her second year of medical school. So I have a little bit of a affinity toward people who are doctors and want to be doctors. And I think most people start out for sure wanting to do something wonderful. And I think, particularly in your case, and a lot of the people I've had on the show, they're willing to look beyond what the medical school is foisting on them. And I understand why they do what they do. And there's a lot of valuable information, but she was telling me that there is an increase in gastro issues for people in their 20s, like cancer, colon cancers and all these things these are young people, not somebody that's been eating crappy food for 40 years. These are young people. And she goes, it's real. She's interested in going into gastro. So she's, pretty fascinated with all that stuff, the microbiome and all those things. But this is kind of what you're talking about. It's, what are we doing to our soil with, all these pesticides and depleting, things that are healthy, and then creating these fake foods that kind of mimic real foods, but they're not exactly.
Yeah, I think we get really ahead of ourselves. I mean, we are literally manufacturing foods in, food plants and not eating actual real food. And the people that are doing it are claiming that it's more nutritious than the food that is natural. And it's like we're living in an upside down world. And it's very scary and concerning that our children and younger people are starting to have a higher occurrence of cancer and autoimmunity and these degenerative diseases. And it's like, we have to, at some point, make a big shift. And I'll be honest, I think the only way that's going to happen is if the consumer starts to shift where they put their money. Because as long as we continue to buy terrible, unhealthy foods, they're going to continue to make it.
That's it right there. It's always about money. It's the money drove people into the wrong direction in terms of, what the products they're putting out. That was money driven. Mm-hmm. It wasn't like, how can we make people as healthy as possible? Oh, no, it's how can we make as much money as we can? Oh, now they're not buying it. So we have to go back to something that makes sense.
That's the only way it's going to change, because right now the food industry, and I mean, their game is how can we make more money and be more profitable, right? How can we get people to buy more of our product, and how can we make our product at a cheaper price?
Yeah.
That is business. And so if we continue to buy the cheaper product, and we don't realize that they're making these foods with addictive chemicals, then, they're going to continue to do it and continue to go down that path unless we as consumers shift.
Yeah. I mean, it's all tied into the economy also, because if you're struggling financially, you're not going to spend the extra money for the healthier stuff. Even though in the long run, you're going to spend less because the medical bills and all the other things that you're going to have on the B side are going to go away or be minimal if you eat healthy on the A side. That's long-term thinking, and it's not easy for people.
That's like investment thinking. And most people don't realize, because most people think that's not going to happen to me. Right. So most people, they think that their health insurance is going to cover if they have these diseases. But it's really sad, because insurance companies, the name of their game is, how can I not pay? So any little loophole that it takes. I was talking to a doctor this weekend, And he said, for me to collect on out of network insurance, I used to collect about 60 cents on the dollar. But he said now it's down to about 20 cents on the dollar what he's able to collect. And so it's not only doctors, but patients are really suffering from dealing with these chronic degenerative diseases that they're expecting insurance companies to pay for. And that's just not the case. So investing in your health is you always will win. And it's not just your health now, but I mean, and not just saying that insurance companies are going to pay for these diseases, but do you really want to live like that, right? Who wants to live taking all these meds and in pain and dealing with blood sugar and, and hot flashes and being overweight and not sleeping and all these things? But life doesn't have to be that way. If you take care of yourself and you listen to your body, you handle the symptoms and you do the right testing to really get down to the underlying issue, and you really prepare yourself for health along this whole journey, you can actually prevent your quality of life from going down in the end.
Great wisdom. And why that is not something that most people understand, I don't know. But, I didn't know until I knew.
We've always thought that the doctors in the healthcare system were going to take care of us. And that just isn't the way that it is. It's like your health is your responsibility and you have to be an advocate. And that is something that hopefully is shifting a little bit, but we have to really get that awareness out there because, and I also think a lot of people think their genetics are going to be their predisposition, like their genetics rule how their life is going to turn out. So why would they eat healthy now if every single person in their family died of cancer or had type 2 diabetes? They think that that's just what's going to happen. And in reality, we know that your environment is what really triggers these genes to turn on and have expression. And it's more about a lifestyle that makes these things turn on, not necessarily just because it's in your gene line.
And that is a lot of hope right there, just to know that you can change. It isn't predetermined. Genetics don't always predetermine everything. I mean, they predetermine certain tendencies, but like you say, it doesn't necessarily have to be turned on by, a lifestyle.
Yeah. I talked to a lady the other day and she was about 100 pounds overweight and she had low thyroid and she had diabetes and she had cardiovascular issues. And I said, well, tell me, what you've tried in the past that might have worked or something that maybe didn't work. Because I wanted to see like what she had been through and how much effort she had put into this. And she said, well, I'll be honest, I haven't really tried much. I tried to decrease calories and maybe increase my exercise like everybody always tells you. And she's like, I don't get very many results, but it's in my gene line. So why would I even try? Oh. And it's a lot of people think that way. And if I just could give them some hope and knowledge about, hey, you can change just a few things and you'll start to see your body feeling better and some of these symptoms going away. And then if you really fine tune and start making bigger changes and they're pinpointed based on your labs and where your underlying imbalances are, you can reverse type 2 diabetes. You don't have to have cognitive decline. You don't have to deal with all these symptoms with low thyroid. And I think it's because they've seen generationally it happen because they didn't know. And so they just continue down that line. But, many people that I see, they'll say, this is stopping with me. I'm going to be the next person that has a great life and doesn't continue these diseases and a great influence and role model for their children and grandchildren and the people around them. Genetic testing gives us a lot of information. It doesn't mean like it could say that you would have a tendency towards type 2 diabetes or insulin resistance. So that you got to pay attention to that. You got to make sure that you're not eating foods that cause insulin resistance. You've got to do the right exercise so that you're really working and focusing and managing your blood sugar. Like there's things that say, oh, well, you're more predisposed to having cognitive decline. So then you can be like, okay, what do I need to do to maximize my brain potential and save that? Because now we are seeing cognitive decline being reversed up to a certain point. And even slowing down that progression as long as you're handling the underlying issues. But there is so much we can gain from getting our genetic profile and then being proactive about it, not waiting for it to happen, but knowing that you can really control that. I do a genetic test for every one of my patients. It is the HLA-DRDQ gene, which tells us do you have an issue clearing out biotoxins? And biotoxins are toxins that come from living organisms. The most common is mold, followed by Lyme. And most of my patients have a genetic issue where they do not clear out these biotoxins very well. So these toxins accumulate in the system. They cause lots of inflammation. They cause a lot of brain fog. They even can cause downsizing in the brain. So we know genetically they don't clear this out very well. So that tells us, okay, we need help clearing this out. And so there are ways that we can work to clear these toxins out of the body, and we can measure the toxins and make sure they're gone or down to a minimal amount. But it's really cool what we can do with genetics and tailoring treatment plans.
Say the name of that test again. I've never heard that specific test. I'm going to write it down so I can know what it is.
Okay. HLA DRDQ.
HLA-DRDQ. Yeah. So some people have a problem that, like, there's toxins in natural occurring foods and plants, and they can't get rid of those toxins. Is that what you're saying? Biotoxins?
We're talking about with mold. So any of these biotoxins, toxins that come from living organisms. All right. So when we're talking about mold, we talk mostly about mold that comes from water damage in buildings. Right. So when drywall gets wet, it'll start growing mold within 24 hours, and it spews off these spores that we will breathe in.
Yeah.
And our body doesn't recognize that it needs to clear this out. About 30% of the general population has this issue, but in my patient population, it's a majority, because my patient population is almost all autoimmune. Right. So that's why it's so important for us to check that. You might have heard of people going into a building and they get sick. It's almost like sick building syndrome. And then other people are like, I'm fine in here. Like, I don't know why you have such a problem in here. And it's because they don't clear the toxins out, right? Like these toxins are building up in the system. They may have a histamine reaction to the mold as they're breathing that in, and they just don't clear it out. Now, there are some foods that have mold in them. Coffee is a huge one. And so we kind of work to minimize those as well, but mostly it's from water damage in buildings. And then the other one is Lyme's disease, which is, it's a tick-borne illness for the most part. You can get it from other things beside a tick, but mostly that's the most common. But most of my patients, yes, some deal with Lyme's disease, but most of them are dealing with some kind of mold toxicity, which it's pretty crazy. Once you clear that stuff out, it really does change a patient's life.
My last episode, which I haven't published yet, but by the time this is out, it will be published. So I'm going into the future here. That was exactly the topic, was mold and mold remediation and mycotoxins and all this really interesting stuff that I really never thought about. I mean, I've seen mold growing in the shower at times, but I was telling the guy, I said, I had a leak in my roof and the drywall's all wet. He goes, uh-oh.
Yeah, uh-oh. Anytime there's water anywhere, I'm like, oh my God, dry it.
I started getting scared. I haven't done anything about it yet, but I'm looking at the stain going, what's growing behind that stain on the inside the wall?
You have to be careful, because then it gets in your vents and people are like, oh, it's just in that one room in my house. I'm like, it's everywhere.
Well, this guy was living in Florida, which is humid central. And I was like, that's not the, at least I'm in a dry place. So I don't know. We'll see what happens.
it is an issue with most places. Like spent the last 20 years in Colorado, and I just recently moved back to Texas. But in Colorado, we're essentially in a desert climate, and we had a lot of issues with mold in patients' houses. And I think, we try to be energy efficient, and so buildings are very enclosed, and so there's not a lot of airflow. And I treat a lot of patients in Arizona, and in Arizona, they still have issues with mold. You're not going to ever get away from it completely. It's just impossible. It's in our hotels, in our hospitals, in our schools, and things like that. We just don't want you to have a consistent, constant exposure to mold, but we've got to really work to clear it out.
Yeah, I'm not a fan of sealed environments, is what they call them. Energy efficient sealed environments.
Yeah.
I feel sick in those places. I don't like it. I don't like fluorescent lights, and I don't like no air from the outside coming in. It's creepy to me. I feel like I'm being assaulted in some way.
When I moved from Colorado back to Texas, I just left the doors open all day. Like all the doors were open, windows were open at night. We raised up all the windows in Texas. It is like so hot and muggy, and the bugs. I moved back. I'm like, oh, I'm going to really miss being able to open up these windows and doors here.
All right. I forgot about this. That's why I moved.
It feels much nicer with the humidity, but my house has to be, we cannot get fresh airflow for sure.
Let's get back to hormones and the thyroid and how it works with other hormones and hormone balancing, because I'm very interested in that whole topic, having had somebody on that we talked about, particularly testosterone and him starting a company based on he had low testosterone, but he wasn't having any kind of sexual dysfunction. He was just sluggish and moody and depressed, and he didn't know he couldn't get off the couch. And he was like, something's wrong. And he was told that his testosterone was, in the range, but apparently the optimal amount has been lowered. The range has been lowered over time. Is that true?
Because it's an average of people going to the lab, and people that are healthy don't usually go get their labs done. And so if we're seeing a lowering of, we are seeing a lowering of testosterone over time. And so you're going to consistently see lab ranges change based on the changing population. Does that mean it's normal? No. It just means
I mean, like, as you said to me, I go, well, I'm in the normal range. He goes, but don't you want to be in the optimal? I go, yeah, I think I do.
Yeah.
And my doctor, who's a really great guy, and he's a pretty open-minded guy, he's like, you're fine. I go, well, I don't feel that fine. I feel like okay. Because, well, I wish my testosterone was as high as yours. I will.
I'm not
Let's raise both of ours. Let's do it together.
Yeah, and I might have a bit of a different perspective or philosophy around hormones, but hormones are very important. And it's also important to know that most sex hormones are at the end of a pathway, right? So, you have to start with cholesterol, which is why it's so important that we don't have super low cholesterol. And then it goes through many different precursors, and we end up at testosterone or estrogen or whatever. But what's interesting is that your hormones, they affect the body everywhere, right? Like that's the definition of a hormone. It just doesn't have one effect. It affects your whole body, which is why when you have low testosterone, you may have a brain fog, you may have low energy, you're going to develop breast tissue, you're going to have a bigger gut, you're going to go through like andropause, which is like menopause, but for men. So you have many different symptoms. It's not just like you would have sexual dysfunction. And many people that have low testosterone have normal sexual function. But as it relates to the thyroid and how the body works, in particular, when we're dealing with people with autoimmune issues, it's really important to understand what all of your hormones are doing. So when you have Hashimoto's or any autoimmune condition, when you have estrogen surges or testosterone surges, it causes the immune system to attack the body. And so we have to be careful. A lot of times people are, handing out a lot of these hormone replacement therapy, right? They're giving testosterone, estrogen, and progesterone to most of my women who are in postmenopausal without understanding that connection that it has with the autoimmune issue that they're dealing with. And so then they start to have all of these other symptoms, and we've got to kind of unwind things. But the way that I look at hormones is if you do have a low hormone, we have to ask why. Why do you have a low hormone, and where is that whole biochemical pathway breaking down? And then you ask, why is it breaking down? So many hormones are out of balance because we have insulin resistance. This is a huge epidemic in our society. Like men may have low testosterone because you're converting it into estrogen. And what's causing that is insulin resistance. So to look at testosterone by itself is a fallacy. We need to look at estrogen as well. And you need to look at estrogen if you're taking testosterone, because if you're pushing it into estrogen, you're increasing your risk for prostate, colon, and breast cancer, even men. And so we have to keep asking why. Like, why do we have this issue? So for women, if we have low estrogen, we need to see why. We need to look at testosterone, because women turn their estrogen into testosterone when they have insulin resistance. This causes PCOS. This causes unwanted hair growth in places. It causes hair falling out. It causes low energy and even a low sex drive, which is counterintuitive. So we also need to look at total hormones and free fraction hormones, because total hormones is what's floating around in the bloodstream. But then the free fraction hormones are what's actually active and able to bind at the receptor site. So I think we need to really dig deeper. I don't want to bore everybody with all the physiology and getting so minute, but we have to think about, right? Like if you have low testosterone, or if the female has low estrogen or any hormone, we have to look at what comes before that. Right? So with estrogen and testosterone, we've got to look at DHEA. Okay, what is your DHEA doing? Well, let's say your DHEA is low. So then we say, okay, well, why is DHEA low? DHEA typically comes from the adrenal glands. How's your adrenal health? How's your body handling stress? What is your cortisol looking like? How's your sleeping? If DHEA is fine, we keep going up to pregnenolone. We look at cholesterol. And this is a huge issue because, every cardiologist wants your cholesterol as low as it possibly could go. But once it goes below 150, you start losing the ability to make all of your sex hormones. And then you start putting yourself at risk for cognitive decline. And so this is another example of how we can't keep looking at the body as systems, because it's all over the place, right? Like your hormones affect everything. Cholesterol affects hormones, how your body handles stress, and all of that affects your hormones, your blood sugar. So we've got to look at the whole being. And if you think you're having a problem with thyroid, or you think you're having a problem with any of your hormones, you want to look at the hormones, but you want to look at the whole picture of what would be causing those hormones to go down. And then what do we need to do to start resolving this whole issue? And sometimes I have seen some women whose hormones are so low, I'm really worried that they are developing cognitive decline and osteoporosis, because that when you have low DHEA and estrogen, it will really increase your risk for those. So we may say, you know what, you need to be on these hormones right now while we're fixing everything else upstream. So let's kind of work with the body so that we can get it back into optimal as much as possible. And even if they needed to stay on a small amount of those hormones after we fixed everything, so be it. But I want to make sure in my clinical practice that I'm looking at all the possibilities that I can to figure out the underlying root cause, so that we're not just, again, putting another Band-Aid on it. But hormones play a huge role in everything, and we've got to look at that. And yes, optimal optimal ranges versus, is it completely gone range?
Yeah,
That
right.
I think goes without saying. We want to really stop looking at the lab ranges to evaluate optimal function. We have to look at different ranges and remember those lab ranges are there to diagnose a disease.
I have two questions when you were talking, and I was listening to everything you said. Just so you know, I wasn't just coming up with questions.
No. Go
They
ahead.
arose out of what you were saying. First is, what is insulin resistance? And the second one was, how does pregnancy and having children change women's physiology that might begin some other issues that they didn't have prior to that?
Yes. Okay. Two amazing questions. So, insulin resistance is where your cells are no longer as sensitive to insulin as they should be or as they were. So, insulin is a hormone produced by your pancreas in response to blood sugar, right? Your body's always trying to balance your blood sugar. And when you eat something that has a lot of sugar or that turns into sugar, that means it's bread, pasta, rice, potatoes, but also cookies, cakes, candy, soda, all the things that we know, right? So when we eat something that causes our blood sugar to go up, then your pancreas secretes a bunch of insulin so that it can get that sugar into the cell. But the more insulin that your cells are exposed to, the more insulin resistant you become. So your cells don't respond to the insulin like it did when you were a child. One of the first signs of insulin resistance is that you get tired or sleepy after meals. One of the first signs of insulin resistance is that you start gaining weight. That's the first sign, or you get lightheaded and shaky if you wait too long to eat. Hypoglycemia or low blood sugar is also on that scale of insulin resistance.
The second one was about pregnancy and childbearing and how that may change a woman's physiology to have some of these other issues that we're talking about. Certainly, obviously, hormones come into play when you get pregnant. So does something get stuck?
Well, it's interesting that you say that because yes, in a way.
That's my layman term for
okay.
something's right.
So when a female gets pregnant, our immune system has to shift your immune system has to shift so the immune system doesn't attack the baby. Right. So the immune system doesn't see that baby as a foreign object that it needs to get rid of. So it shifts.
That doesn't come till the teenage years.
Well, it may shift back then. But while the baby is in utero, the immune system's like, all right, this is supposed to be here. All of our hormones are telling us that this is supposed to be there. We don't want to attack it. So your immune system shifts. And a lot of times it doesn't shift back after you have that baby. Most women are diagnosed with an autoimmune condition after the birth of a child. Now, not like the day after, but it's like, a couple of months later, when we can no longer say, oh, all of these symptoms must be postpartum. But Hashimoto's in specifically usually turns on after the birth of a child. And then we blame all of the symptoms of postpartum. And then, we're like 5-10 years later, we still have these symptoms. And we're like, okay, this doesn't fit with, me just having a baby. And then we finally do more testing. And most of the time, and they get diagnosed with low thyroid, but the Hashimoto's or the immune attack has been going on for a while until the immune system has attacked the thyroid to the point where it becomes hypothyroid. But hormones play a big role. And I talked about earlier, like when you have estrogen and testosterone surges, then it'll cause the immune system to attack the body. That's why a lot of times when we have autoimmune conditions, with our menstrual cycles, a lot of the symptoms will get worse as our hormones are shifting. And then as we transition through the phase of menopause or postmenopause, your hormones shift again. And so usually I see women after the birth of a child. I also see them when they move through menopause and their symptoms all get worse because their hormones are shifting so much. And then we have to really look big picture and work to handle all the underlying issues.
Yeah, because I've seen with my wife different phases of her, pre-pregnant, pregnancy, right after pregnancy, and now she's 60. So now we're into the menopause phase,
Yeah.
and each phase has had different sort of issues. A lot of it's tied to food, and somebody said to her she because she was eating and not being satisfied, that she was leptin resistant. And I know that has to do with insulin and on some. Can you explain that? And
Well, yeah, when you're leptin resistant, it means that your body is not efficiently burning fat. But the whole leptin resistance, when you have that, it'll make it hard for you to feel satisfied.
yes,
So that's like when you go to the cupboard and you're like, I'm not really hungry. I just want, like, you kind of have the munchies, or you just want to eat something, but you're not sure what you want to eat and nothing ever.
yeah.
And so you'll find that you graze more all day long, but you're never really fully satisfied when you have issues with leptin. And when you have issues with leptin, it's very hard to lose body fat because your body is inefficient at using fat for fuel. And it is all tied to insulin resistance as well.
So the solution for that would be some sort of supplementation or diet change,
yeah.
or,
So for what I would do with my patients is I do very thorough testing. All right. So we look at everything. I look at thyroid. I look for underlying infections because that'll impact your blood sugar. We look for, we look at all of the things that would be related to insulin resistance. We look at all the hormones, adrenal function, thyroid, all of that stuff. And then we would look to see where the underlying imbalances. Like with insulin resistance alone, diet is a big thing. You cannot change or reverse a chronic degenerative disease without changing your diet because you're always trying to regulate your blood sugar. And you want to make sure you're getting rid of foods that are inflammatory or that you may have a sensitivity to. But beyond that, you have to look at what are the underlying imbalances. And what I was saying is like insulin resistance. It could be an underlying bacterial or viral infection that you have no idea that you have. It could be a gut infection or a parasite that you have no symptoms of whatsoever. It could be that you have a food sensitivity or maybe your liver is not functioning as well as it should. Likely, liver plays a huge role in your hormones, right? Because all of your hormone clearance pathways are in the liver and detoxification, and the liver plays a huge role in balancing your blood sugar. So looking at all the underlying issues that might cause insulin resistance are important, and then customizing the nutritional supplement protocol based on that, along with diet and exercise and lifestyle, is really important. And then going back to retesting. So it's important to test in the beginning, but it's just as important to retest. We retest our patients' blood work every 45 to 60 days because when you're handling the underlying cause, your body shifts and changes quickly. And so we can also shift and change if we're not seeing the expected results. So we continue to test over time and change as the body's healing. But you have to really get down to the root cause of why people have these issues. And I think it's interesting today because we have a ton of information, like these podcasts, like I learn a lot off of Instagram and Facebook. But it's almost like there's so much information, it becomes confusing. And then we think like, oh, maybe it's the leptin that's a problem, this leptin resistance, or maybe it's these hormones that's a problem. But we've got to remember that you have to continue to look at the whole picture. And sometimes the basics or the foundations, they get overlooked. And if people would just really focus on the foundational issues, you would see tons of progress, like handling blood sugar and getting your diet right and making sure your liver is functioning well and making sure all three phases of detoxification are working properly. Like those things move the health big time.
Here's just a money question. Does insurance pay for all this testing, or people are having to come out of pocket to do it?
People are coming out of pocket to do that because remember, the insurance companies are trying to save money. And the insurance companies don't want doctors testing if they don't have a drug for it. Like, let's just take, for example, homocysteine. Homocysteine is an inflammatory marker. It tells me how much inflammation is in the brain and in the cardiovascular system. It's also related to methylation and detoxification and blood sugar. It tells me a lot. And I have things that I do that I implement in a patient's treatment plan that lowers homocysteine, and it is directly tied to improvement of health. But in traditional medicine, there is no medication really to lower homocysteine. And that marker, that one marker, if we ran it through insurance, would be $250 to the patient. They kick it out and send the patient a $250 bill. And it's just insane. But there are ways, like I do a lot of testing for my patients, but I give them my testing at wholesale pricing. So the testing that I do is, let me think about, if I did blood, saliva, and urine and that genetic test that we talked about earlier for mold, if we ran it through insurance, that would be about $3,800. Most people cannot afford that, nor can they afford to do it every 45 to 60 days, right? It's just not doable. But that testing for me is $675. And I give that directly to my patients so that, first of all, I can't treat if I'm not going to guess. So I have to have the data so I know exactly what to do to help patients. So I need that. And they also need that. So we want to do it at the wholesale pricing. And even the blood work, I can get it's about 10, the wholesale pricing for me is about 10% of what they bill insurance companies, which is just crazy.
Yeah, and
the whole system's a mess.
Well, yes, we know that. Oh my, yeah. Sorry you have to, wrangle around that stuff because it's super annoying for the doctors that really want to do things for the patient rather than for the pockets of whatever.
Yeah. And I would say, I try as much as we can to help patients take advantage of their insurance, right? Like if insurance is going to pay for blood work that we do, we certainly would utilize
right. You try to do both. Right.
We do. And for the patients where their insurance doesn't cover it, then we're going to do, our cash pricing and do the best that we can. But I think doctors are really handcuffed when they are in network with insurance companies because insurance companies dictate the patient's care. Look, I have a really quick story. I had a patient, I was looking at her labs, and she was severely anemic. Her reticular count site was super high, which is immature red blood cells. She had an internal bleed somewhere. Like she was bleeding, and she was 90. How old is she? 89. Her 90th birthday is coming up. And I said, all right, I need you to go to your GI doctor, and I need them to do like an upper GI. I need you to send them this blood work and let them do the testing that they need to do to find out where this bleed might be, because she was extremely exhausted. She had cognitive decline, and this is a big problem. So she goes to her doctor, and her doctor said, "Oh, we don't do these tests on patients once they're past 70." Like, what are you talking about? They're like, well, it costs them too much money, right? If they continue to do all this testing, it's like the system has given up on people as they reach a certain age. And thank God for her daughter, because her daughter was like, no, we are doing this testing that I know Medicare is going to pay for it. Like, I'll jump through whatever hoop. And in the end, they ended up doing it, and they found what was going on. And her doctor was like, yeah, we saw that on the last blood work, but they were scared to do the additional scans and testing to figure it out, because essentially she was just too old. I'm like, this is ridiculous. We are fighting for you to figure this out.
He actually came clean that he knew it was there and didn't do anything about it.
Yeah. I said, I can't believe they told you
It-
that.
the guy was just, what an idiot that he would cut his own throat that way. I mean, I guess you could pursue it in some sort of a malpractice in a sense, but it's not
Yeah,
really
but
malpractice. It's lack of practice.
yeah, but the system supports that. So they're going to be like, well, according to her age,
Oh, that's horrific. Like
it
you don't
is.
count anymore because there's no money and you're going to be out anyway. So we don't,
Well, you're just making us spend more money, right? Like it's
Oh,
just, it's a sad situation, but there are ways around this testing and the cost. And we can get these tests at a cost that is doable for most people.
and do you use your own sort of specialized lab or a lab that's a little less tied in with the corporate thing? Is that how it works? I mean, I don't know because like I'm a UCLA patient. That's where my
Yeah.
doctor is. So when I go get tests, it comes back in a day. It's fast. I mean, I love that they can do that, but I have to ask for certain tests, and I just asked for another one. And I'm going to see if they do it because I've had my doctor go, oh, they won't pay for that. He'll just say it.
Right.
He goes, and it's not him.
That's right. Yep. So yes, we use a company called Evexia. So Evexia is almost like they negotiate with LabCorp.
Okay.
And so we go through LabCorp. They do all of the blood draws and the analysis, but Evexia will do all of the negotiation with them because they have a big group of doctors, and essentially we buy down the cost of the test. It's like a co-op.
Okay. Great idea. And that's the way to
Yeah.
go, I think. Yeah. So, folks who are listening, there's a lot of ways around things that are roadblocks. They're just roadblocks, so we can go around them, hopefully in most cases to get the most optimal health. So let's plug you what you do, and if people want to get a hold of you, and anything you got going on, whatever you want. We want people to know more about Heather Stone, Dr. Heather Stone.
Well, any females that are dealing with any kind of thyroid issues, or maybe they have every thyroid symptom, even if they haven't been diagnosed. I have quite a large group on Facebook, and it's called Happy, Healthy, and Lean. And if you just type that in and search for it, you'll see my picture on the banner. So it's easy to know that you're in the right place. They can also find me on Instagram at Dr. Heather Stone. And then I recently wrote a book. It's called Thyroid Transformation Blueprint. And they can get that on Amazon. Also, I do have 2 free chapters that they can download if they want to go to thyroidtransformationbook.com.
Great. So if you want to know if you like the book, you can try it out.
That's right.
You can read it. It doesn't cost you a penny to get some knowledge. Then if you want more, you'll get the book. That's how it works. Yeah. It's called a teaser. That's what they call it.
Well, or it could be like you're just taking it for a test drive, right?
Yeah, a test drive. Also a teaser.
Yes, also a teaser.
Right. Do you like the ride of this car? Well, you should be in this car. We have made this car just for you, folks. Well, thank you so much for being on the show. I have learned a ton, and I hope women that are listening are really going to maybe realize that there's something going on that they can do, that they can fix.
Yes. Awesome.
Or improve. Yes. Let's put it that way. Improve.
Exactly. Well, thank you for having me on. It's been fun.
Yes. Same here. Have a great day. Much appreciation for you folks listening to The Exploding Human. Check out the website, theexplodinghuman.com, the YouTube channel, The Exploding Human with Bob Nickman. I want to thank Dr. Heather Stone for being on the show, and you guys have a fantastic day. Thank you.